time. People say, in time heals. Here's the thing. When you're grieving the death of a loved one, you will grieve them forever. And healing is ongoing. Now, that doesn't mean when I say to people, I'm going to feel like this forever. No, you're not going to feel like this forever if you're in your new acute place of grief. It softens. We grow around it. But you don't get healed from it either. The healing, and I say healing, feel it. You got to feel it to heal it. But the healing's ongoing. It's an ebb and flow.
Welcome to The Patient from Hell, the show where we discuss real stories, expert insights, and build a community that every cancer patient and family deserves. Today, we're diving into the world of grief with Holly Gainsboro, a grief specialist who lost her life partner and love, Stephen, to glioblastoma. We explore what it means to bear witness to someone's life, to unravel the complexities of anticipatory grief, and discuss practical ways in which some of us who are dealing with loss can manage that. What stood out for me was how Holly has taken what she calls pain and transformed it to purpose, how she really has understood on a personal and professional level the many intricacies of grieving and the very practical ways that we can change our day-to-day to manage it. Holly, thank you for being a guest on the show. Welcome.
Well, thank you for inviting me. I'm delighted to be here. I know we met so long ago, and so it's great to finally regroup and do this together. This is awesome.
Thank you. Thank you. I am very excited. I have a feeling we're going to learn a lot about a topic that I think is hard for a lot of people to talk about. So I'm excited for us to unpack it. Before I get ahead of myself, maybe we start with, how did you end up in the professional space of grief?
Well, it certainly wasn't something I ever fantasized about, right? We all think of different things we want to do with our lives. Grief and being a grief coach, grief specialist was definitely not at the top of my list. I always loved being present for people in general. It just was something very natural for me. But then when my late husband, Stephen, which we'll talk about, when he died from glioblastoma, I just found myself pulled to be present, really present for other people. And it's funny because people will say to me, well, who was your Holly? And I had a good therapist, although I look back now, and it's really funny because I think, I can't believe some of the things my therapist actually said to me. Now that this is my lane and this is all I do and all I talk about, and she was great, but I think, could have handled things a little differently at times. But again, I just really wanted to be there for other people. And so that it sort of just evolved in just through friendships, other people going through something. And I can expound even more on how it all came about and what the impetus was for me. But I just knew other people were in so much pain and I was in pain. And I felt like not everybody got it. Most people didn't get it. Even those closest to me tried to get it, but they didn't get it.
Before we jump in there, can you tell us about Stephen's glioblastoma diagnosis?
I can tell you about Stephen's glioblastoma diagnosis. So he was diagnosed on February 12th, 2009. I always say when I speak about this, that there are some dates, and you know this for yourself, there are some dates we just never, ever forget. Diagnosis day is one of them.
Yep.
And it stays with me. Now, it's been 16 and a half years almost since he was diagnosed. And he survived for 22 months. But that day, which is true for pretty much anybody that's been diagnosed with something or their loved one has been diagnosed, it's like whiplash. Like, that can't possibly be. And when he was having headaches, which he didn't get real headaches. He wasn't a headache person. But he had some headaches, and I was like a little concerned, and I noticed some confusion. I noticed some things with him that were a little off. And then we were driving. It was our son's birthday weekend. Our son was just turning 16 at the time. And I remember we were driving, and Stephen took a really wide left turn and almost sideswiped a car because he went into the other lane. And I was like, Stephen, did you not see that car? And he said, I did not see that car. I said, you need to call the doctor first thing in the morning, and we need to get this checked out. There's something going on. And so it was a whole interesting path that it led to. So he went to the doctor that Monday. The doctor said, go to your eye doctor. I want to get that checked out. It could be anything. And Stephen let him know that I really want him to get a CAT scan, MRI, something, like what's going on. And so he was very placating. And I sort of like think of it, I wasn't there, but I think of it as like, let's just pat the dog on the head. Okay. We'll do what Holly wants. And he said, okay, Holly wants you to get a CAT scan. We'll set that up for Friday. Now this is Monday, but he's going to wait till Friday. And I'm like appalled, but I'm like, all right. So then the next day, Stephen goes to someone who was a very dear friend of ours, an ophthalmologist, looks at him and looks in his eyes and tells him it could be a number of things, but you need to get an MRI and you need to get it right. And this was end of the day on that Tuesday. We need to get it tomorrow. So Stephen comes home and he tells me this, and we're both not able to sleep because we can't, like, what's going on? What does this mean? And so the next morning he calls the primary care physician, says, you need to get me in for an MRI. And Stephen's telling me they want me to go someplace like further from where we live. Now, Stephen shouldn't even be driving, but he was driving that day because I called our friend, the ophthalmologist, and said, tell me what you told him. Because sometimes everybody's the best reporter, right? And so he told me, and I said, should he be driving? He said, no, he should not be driving. So he drove to work. I told him that. Steve was kind of stubborn. He said, but he drove to work. So they were going to send him up. We're in Charlotte, North Carolina, up to the university area, which was a good half hour, 45 minutes from us. And I was like, hell no. So I called the primary care physician's office and I said, you need to get him in for an MRI now, close to where he is. And he's at work, and this is where you need to send him now. They're like, oh, okay. And they did.
Wow.
So we got his MRI. And then I got a call from the doctor's office saying that his primary care physician would see us Thursday morning. So Thursday morning, we go meet with the primary care physician, and he pulls up the scan, the CAT scan, the MRI, I'm sorry, and said, yeah, the report says it looks like a cyst or an abscess. Okay. This we can do. This is okay. Go back in time for a minute, and I know we will probably talk about this anyway. My uncle, my father's younger brother, died from glioblastoma in 1989. So I'm like, okay, cyst, okay, this we can do. And he said, but he needs to have it out. So I'm going to set you up with a neurosurgeon for this afternoon to go meet this neurosurgeon. So we go and see my parents. I tell my parents, and my father's like, I said, I know. It was like twice in one lifetime, but this is nothing. This is not what, Eddie had. It's nothing. I then have to tell my kids, because we have to go now to go see this doctor in the afternoon. So our 16-year-old son comes home from school, and I say, I need you to meet Liana, our daughter, who is now in 6th grade, at the bus. And he's like, what's going on? And I don't remember what I said, but whatever it was, I'm sure it wasn't helpful because I scared the shit out of my kids. So anyway, we go to see the neurosurgeon, and Stephen calls his sister just to let her know what's going on. I got the cyst or something in my brain. She's like, okay, well. So we go into the neurosurgeon's office, and he pulls up the scan, and he says, you have, and at that time, who could pronounce glioblastoma? But that's what he said. Now, I didn't even remember the name of my uncle's brain tumor from 1989, 20 years later. Right? Fast forward 20 years. And so we said, it is, it's a terminal brain tumor. No, it's a cyst. What are you talking about? It's an abscess or a cyst. He said, Holly, it's a brain tumor. It's a malignant brain tumor. And I'm like, but no, if that's not what, And he said, Holly, he was very kind. He was very sweet. And we both kind of like, what? Like I said, like whiplash. And I remember the first thing I said is, what do I tell my kids? And he said, you don't tell them anything. You tell them that something's going on with Dad's head, but you don't tell them what it is until we know exactly what it is. Because we won't know really until we get in there.
Yeah.
Okay. And then we scheduled neurosurgery, the brain surgery with this surgeon, which we ended up changing and went to one of the top brain tumor centers in the country and here in North Carolina. So that was when we heard this news. And I remember Stephen thinking, Stephen said something so fascinating to me, because we were both so shocked. And he said, maybe I should just die now and take, and not be a burden to all of you. So obviously there was some ideation there for a moment.
Yeah.
And I said, no, that's not the legacy we're leaving our children. We're going to fight this. And this is what we're going to do. And we talked about the kids. I remember we're in the parking lot. We're in the parking lot of the doctor's office. And we talked about the kids. And he looked at me with such beautiful wisdom. He was such a beautiful man, such a beautiful soul. And he said, our kids are going to be more compassionate from this experience.
Oh.
I was like, who are you? What have you done with my husband? Because with brain tumors, and with my work, that's all I do is work with people whose loved one has or died from a brain tumor. Depending on what the tumor is, personalities can change. They can be belligerent, they can be difficult, or they can be who Stephen was. And I was very blessed that who he was in the depths of his soul came out. And he just was an amazing human. So that was the diagnosis. And then, of course, having to tell the children, which was like a knife in my heart. I'd have to share them. But we said, Daddy has something in his brain. We don't know what it is. And then we just had to keep going.
How did you and Stephen meet?
So it was a blind date.
What?
It's a great story, yes. But it was a blind date for him.
Okay.
So I knew who he was. So Stephen and his family, so we're from Boston, Massachusetts, in suburbs called Newton. And Stephen and his family had a women's clothing store called Ava Botel. And I used to shop there all the time. I would go in there a lot. And he was there. And I thought he was the cutest man I'd ever seen. Like, I just crushed on him for years.
Oh, wow.
I mean, years. And then he opened a men's store across from the women's store. He had his own store, and his mother worked with him. My best friend, Jody, used to go in there because she would shop for her husband. And they would start to talk, and he was just getting out of a relationship. And we always used to say, don't ask Stephen Gainsboro how he is, because he will tell you. He wore his heart on his sleeve. And so he was sharing about this past relationship. Anyway, one day, Jody's husband, or now her ex-husband, went in there to return something. And my late mother-in-law, Jane, was there. And he said to her, is that your son? And she said, yes, it is. He said, I have a girl for him. And here's her phone number. Goes home, tells Jody. Jody calls me. He's like, oh my God, Stephen Gainsboro has my phone number. I was like, yeah. Now I was 29 years old when I met Stephen. I wasn't like a kid. I was just like, oh my God, it's Stephen Gainsboro.
Wow.
Like, how cool is this? So that's how we met. We met through my best friend's ex-husband. And I mean, like I said, I crushed on him. I couldn't believe I was going out with this guy I had a crush on. And, and we dated for quite some time. And then when the day we were getting married, my mother and I went for lunch beforehand. And she looked at me and she said, Holly, not everybody gets to marry the man of their dreams.
Oh, wow.
They don't get to marry their heart's desire.
Oh.
And yeah. Now I am since remarried. Since Stephen died, I've been married 11 years, and I am very blessed to have that love again. But it's exactly what Stephen had wanted for me and made it very, very clear when he was diagnosed and near the end of his life. I want you to find love again, and I want you to get married again.
Oh, wow.
What a gift.
So you have 22 months after this diagnosis.
Yes.
In the world of glioblastoma, that's actually...
It can be a long time, and it can also be, the shortest time on earth. Everybody's different. We know, this. There are long-term survivors out there.
Yes.
There are 5 year, 6 year, 11 year, 20 year. I know a 20-year survivor. So there are, which is amazing and unheard of, and he's doing well. And that's always nice. When I meet people in the brain tumor community and I meet new patients or families of newly diagnosed patients, my first thing I say to them always is, there are long-term survivors, so why not you? Why not you? I'm just going to carry their hope. But 22 months.
How do you balance that? How do you balance carrying hope and anticipatory grief?
So I didn't know it was anticipatory grief. I never heard of that. I didn't know anything about grief. I had and I've talked about this in the past. I had experienced losses. My uncle died in 1989 from glioblastoma. My grandfather died, my father's father, my uncle's father, died exactly 1 month to the day of my uncle's death. My grandfather was in his 90s, died right after I married Stephen. My grandmother died right before 9/11. So it's not like I hadn't had experiences with death and experiences and loss and non-death losses, which I didn't know you grieve non-death losses either. So I didn't know that it was anticipatory. I didn't know I was grieving. Now when I tell my story, I say my grief started on February 12, 2009. But if you had asked me that day, are you grieving? I'd be like, I don't know. He's alive. Why would I be grieving? But I knew that I was scared and I was sad, and it was all so very surreal, especially those first few days and getting him the care. And I worked my butt off to get him the care and to get him, up to the Brain Tumor Center, in Durham. It was important to get him there. And I worked hard to get him there. The balance, I don't know how you find the balance. I think you just, for me anyway, I just did what I had to do. I had 2 teenagers. I had a 16-year-old and a 12-year-old, a preteen, 6th grade, 10th grade. I have to be present for them. I have to give them some sense of normalcy, especially before we knew what it was. And I didn't tell them what it was till we got home a week after surgery. And I wanted some normalcy for us. So the day after Stephen was diagnosed, now on February 13th, that Friday morning, he woke up and he said, and it's funny because he woke up and he said, oh, I forgot I was dying. I said, first of all, you're not dying. Nobody's dying on my watch. You're not dying. And I'm never dating again, so you're going to be fine. And that was my ongoing joke when people ask the stupidest question, which is, what's the prognosis, right? Yeah. So that was always my response. I'm never dating again. I'll be fine. And then he said what most patients, not all, but most patients say after just being diagnosed is, oh, why me? Oh, God, why me? And I looked at him, and I may have said this to you when we talked last. Baby, why not you? Like, what makes us? And I said it in a loving way. Some people think that's really harsh. I said, what makes us more special than anybody else, or like the child in the hospital with this? And in that moment, he turned and he looked at me. He said, you're right. And from that moment, for 22 months, he never asked the question why, and he never complained. Not once. And so that's part of it, right? That was part of our journey together, is finding the balance with the hope and the grief from it. We're going to live in this place of hope, and he was amazing. And it was a choice. You can make a choice. And some people maybe don't have that genetic makeup to make that choice. I think for us, we just did. And because I am a very upbeat person, and my glasses always half full or can be refilled, we just decided this is what we're doing. And we're gonna plow through this. Now, when the diagnosis came, when we knew for sure after his surgery, and I remember the surgeon sitting with us, my sister-in-law, Stephen's sister, was with me, and he came in and told us it is glioblastoma. We're going to send to pathology, but it is. They could tell. I've been doing this for a long time. And I remember I just sat there crying. And then I think Amy said to him, so who tells him? Who's going to tell him? And I said, well, I'm not going to tell him. I'm not going to be the one to tell him this news. And so Dr. Alan Friedman said, I will tell him. We said, okay. So we went up, and then we're still sitting there crying in the small room. Because when they bring you into the small room, it's not going to be good news, right? We're sitting there crying in the small room. And then all of a sudden, we're like, oh, shit, we should probably go up to see Stephen. Like, we're sitting, he's probably like waiting for us. So we go up, and the nurse said, he's been waiting for you. And we go in and we see him. Now, Stephen was one of the funniest people I've ever met in my entire life. He should have been writing sitcoms. I am not kidding. And we walk in, and in true Stephen Gainsboro fashion, he looks at both of us. He says, who are you? Deadpan. And I look at him and I say, you suck. Because I knew he was kidding. Somebody else would have been like, huh? Because he would do that to people all the time. He'd say, Stephen, how's it going? I said, do I know you? And they would look at me and say, he's kidding. It's just Stephen being Stephen. And so we asked, how did it go? I said, the surgery went great. The doctor's going to come up and talk to us soon. And then he did, and he told Stephen. And I remember a tear coming down his face. And I said, baby, our path has changed. But we're going to do what we need to do. And we are so solid. And we're going to do this. And we're going to get through this. And we did. We did until we didn't. Right? We did until it ended.
Yeah. Yeah. When did you realize that you were grieving?
When he died. When he died, that's when I realized I had been grieving all along. Just didn't have a name for it. Like I said, I didn't know. And I was so busy. Sometimes I would say I didn't have the luxury to fall apart. I had kids at home. I had a husband I was trying to keep alive. And I worked. I was also working. And I worked in my synagogue. And so I was around families every day, and the kids and the teenagers, because I worked in the bar mitzvah program. And so I was busy with the kids. So not just my own.
Was Stephen working at the time?
He was working at the time. Stephen worked for Second Harvest Food Bank of the Carolinas.
Wow.
And yeah, it was his favorite job. He had a lot of different things. He was in retail. They said he had a clothing store back in Boston. We moved to Charlotte from Boston, and he worked in retail for many years. Went to real estate. Was trying to find what fit for him. And he always wanted to do something for the greater good. That was like his passion I've got to do something for the greater good. And so he applied for this job with Second Harvest Food Bank years before, and they hired somebody who had experience. And then 2 or 3 years later, they advertised for it again. Help wanted. There was nothing really on. You didn't see a lot online. It was all in the newspaper usually. It wasn't a lot online back then. And he went and interviewed again, and the executive director said to him, "I made a mistake not hiring you the first time." Because he just had this way. And so he was a food solicitor. He procured food and non-food items for the food bank, and he loved it. He loved it so much. And even at the end, and they would come visit him, the people he worked with. And he went back to work after surgery, when he was allowed to go back, and he went back to work, and they brought him back. And then when he had his recurrence, almost a year later, 10 months later, he couldn't work anymore. Like, he would go in a little bit part-time. I'd drop him off, or he'd get a ride and he'd stay. And then at some point he just really couldn't work anymore. But they were so generous to him in so many ways. But they would come visit. I remember near the end of his life, him sitting with the executive director and then his direct supervisor. And he put his hand on their hand, sitting on the sofa. And he said, "We need to feed the people. We've got to get food to the people." And it was so important to the very end. It was so important to him. And so my neighborhood actually did a food drive in his honor while he was still alive for the food bank.
Wow.
Yeah.
How did you end up going from working in a synagogue with kids to being a grief specialist?
Well, I left the synagogue. So when Stephen died, I was still working there. 6 months after he died, I left the synagogue and went to do something else. And then that didn't work out. I was a contract employee for a bank, and they were doing layoffs, and contract employees were the first to go, which was fine because I actually needed some time. I was exhausted. I tell people, any caregiver, that when your person dies, you're now recovering from caregiving and you're grieving.
Yeah.
So your exhaustion is layered.
Yeah.
So I didn't work for a while, and then I did some other things. But I always wanted, like I said, to do something to support other people. So how did I get into the grief field? Really, my original plan was I was going to go back to college and get my master's in social work. But because of my age, I was in my 50s. I was 51 when Stephen died. It's like a year or two later, I brought my transcripts to UNC Charlotte, and they wouldn't accept my undergrad credits. I think they must have expired or something. It was a long time ago. And so I needed to go back and do like general ed. And I said, "Forget it. I'm out." I said, "I'm not doing that." And I'm really glad I didn't. And I'll tell you why in a minute. I'm really glad I didn't. So then I had a best friend whose wife died about not quite a year and a half after Stephen. And we were very good friends. And I knew the wife. She and I weren't friends, but we were friendly. The kids knew each other, all from our synagogue. And so he was very different, and his wife died, and I was very present for him, especially in that first year. And even during her illness. That man is now my husband. So that is Joe, my husband, Joe. So we were best friends, and we would take these long walks. And he kept saying, "You need to do something with this. You just have this gift of knowing what to say and what to ask at the right time." And he'd watch me because we had other friends who had spouses die within that same time frame. We would all get together once a month and have very irreverent nights out, and just make jokes, because who else can you make jokes with about your spouse being dead but other people whose spouses are dead? And so I would call us widows and widowers gone wild, because we would just be completely, if anybody were listening to our conversations, they would have been horrified. But we would sort of joke around, but also there was a lot of tears and real conversation. So it was almost a support group, in a sense. And so Joe would say to me, "You need to do something with this." And I was like, "Yeah, I don't know. And then we got engaged, and he still was pushing me. And that's when I said, "Okay, I'm just going to do it." And so I just started looking into certification programs. And I kept doing all different programs I've been doing this for over a decade now, and
Wow.
started with one model, and I found that wasn't working as well. So I just kept learning and growing in the field. And when I say to you before, I'm glad I didn't get my MSW, because all I want to do is work with grievers. And the interesting thing that I've come to learn is, and I think therapists are wonderful, and I think MSWs are wonderful, and psychologists, psychiatrists, it's a beautiful field, it's a necessary field, but there is no required course of study in grief and loss.
I didn't know that.
I didn't know that either, and I've come to learn that. So maybe they take a course in death and dying, maybe. But if they want to be able to bear witness to those who are grieving, they have to step outside of the graduate program. And so when I meet with people, and I say I'm not a therapist. This is I'm a grief coach, grief specialist, whatever you want to call me. I've got so many certifications.
Yeah.
This is my lane. This is all I do. I said, they'll say, well, do you take insurance? I really need someone who takes insurance. I said, I do not. But if you need someone who takes insurance and you're looking for a therapist, I want you to ask them what is their grief specialty and what are their grief credentials besides their graduate degree. You need to know what is their experience in working with grief. Because unfortunately, and like I said, I love therapists. I have a great therapist, but sometimes they're misinformed. Yeah. And I've done workshops and programs, and I hear some things that therapists will say, and I'm like, oh my goodness, that's not appropriate. I'm usually a little more colorful with my language with that, but so that's how, was Joe really the impetus.
Wow.
And really, it's really the encouragement and the belief and trust and faith in me. And so that's how it started.
Wow. Okay. I have so many questions for you.
I have so many answers.
I love it. Okay. I'm gonna jump a little bit more into, I'm gonna say advice. I don't actually mean advice. I'm
Guidance?
gonna ask you guidance. Thank you so much for that. Okay. I'm gonna ask you a couple of questions that I'm hoping that anybody listening to this can get and take away something if they're in the space of either anticipatory or actually post-loss grieving. The first one is, how do you know you're grieving?
That's a great question. It's a feeling. Sometimes you can't name it. Like I said, I couldn't name it while he was alive. At least I don't think I could. I don't remember. It's been so long too. 16 and a half years since diagnosis and 14 and a half since he died. It's a feeling and this ache in your heart, this heaviness, almost like a weight on your chest. It's this longing and this yearning if your person has died. It's the longing and yearning for what is no longer here, for who is no longer here, and the relationship. And this pain that is so deep and so agonizing at times. I think that's the best way to describe grief, even if you're not crying, right? Everybody has different grief styles. Sometimes the tears don't come. Sometimes they do. And I don't want people to feel like, well, I'm not crying. What's wrong with me? Nothing. Nothing is wrong with you. Maybe they'll come at a different time. They usually do come. But you get to grieve your way. But that longing, that missing, that feeling like you're missing a part of yourself.
How do you define anticipatory grief?
So, and some people are not comfortable with that word. It's so interesting. I'm working with somebody right now, and her mother was her mother had been diagnosed a while ago with GBM, glioblastoma. And I said something about her being an anticipatory, which is, I don't like that word because I don't want to think I'm anticipating her death. I said, well, let me reframe it for you. So I'm going to reframe it. We can also call it, pre-death loss, which is also kind of like, or just diagnosis grief. Grief from diagnosis. But anticipatory grief is not just the anticipation of the death, but anticipating what is this journey going to look like. Anticipating the dreams, hopes, and expectations that have now changed, and what are those dreams, hopes, and expectations now? It's anticipating what this is all going to look like. Because even you may have a loved one, if it's not, I'm enmeshed in the brain tumor world, but there are a lot of illnesses and diseases that people are diagnosed with that are curable. Or if they're not incurable, people have longevity. It doesn't mean just because you get a diagnosis, you're going to die. And so even with that type of diagnosis, there's still some anticipation. What is this going to look like for us? What is treatment going to look like for us? What's our relationship going to be?
Yeah.
Who am I now? And who do I want to be? How do I want to show up? We can have anticipatory grief after the person dies. I just talked about this in the grief support group I lead last night from the National Brain Tumor Society about someone's loved one's anniversary is coming up or a birthday is coming up. And there's this anxiety that sits in and they're just like, I don't know what I'm going to do that day. And I said, well, that's also anticipatory grief. We're anticipating certain dates and times that are going to activate our grief. So it's not just expecting and waiting and anticipating death. It's so encompassing in so many levels.
What are some harmful myths or platitudes that you've heard about grief?
So many, my friend. And I say, people are most of the time, are so well-intentioned and they're just so misinformed because I've said this to you, we are so grief illiterate. What is grief illiteracy? It means we don't know enough about grief because nobody's taught us. I wish we could teach it in school about loss and grief because we have stories that come from our grandparents to our parents to us, coaches, teachers, clergy that don't tell us what grief really is, but tell us how we're supposed to respond to it. This is how you're supposed to feel. So what are some of these platitudes that people say? Be strong. You got to be strong. Even with a diagnosis, you got to be strong. Be strong for your kids. You got to be strong for your husband. You got to be strong for your wife. You got to be strong. Just be strong. And I was like, well, what does that even mean? Because there's so much strength in tears and so much strength in feeling and embrace. There's more strength in feeling your pain and allowing yourself to feel your pain. That takes strength. That takes courage. Showing up for support. That's where the strength is. It is not weakness when you cry. It is not weakness to feel bad and sad and scared and joy all in the same breath. So that is the big one. Be strong. I know how you feel. I know how you feel. My cat died. Now, listen, I am all about supporting people in pet loss because pet loss is real, right? Fur babies. I have a friend whose fur baby just died. Painful. Absolutely. But we can't compare our losses to anybody else's, even if it's a similar loss. I say this every month when I lead the grief support group for brain tumor loss. And I say every single time, all of us here have experienced the death of a loved one to a brain tumor. But not one of us, and there's usually 50 people there, not one of us can say to the other, including me, I know how you feel. Because our relationships are unique to us and our grief is unique to us. So I know how you feel. Don't do that. Don't say that, people. So that's one of them. It just takes time. In time, you'll feel better. And you know what? You know this, but Samara, you know what time does? It just passes. It's what are you going to do with your time?
Yeah.
And while time, people say, in time, time heals. Here's the thing. When you're grieving the death of a loved one, you will grieve them forever. And healing is ongoing. Now, that doesn't mean when I say to people, I'm going to feel like this forever. No, you're not going to feel like this forever. If you're in your new acute place of grief, you're not going to feel like that forever. I mean, look at me. I'm 14 and a half years out. It softens. We grow around it. The love sort of takes over, bigger than the pain. Sometimes it closes in on it as well. But you don't get healed from it either. Right? The healing, and I say healing, feel it. You got to feel it to heal it. But the healing's ongoing. It's an ebb and flow. So it just takes time as one of my, I don't love that one either.
What daily practices have you seen have either helped you or helped someone else the most?
Meditation. People say, well, I can't get still with myself. I can't sit quietly. Well, meditation isn't just sitting there and going, sitting there with your eyes closed. Meditation can be done in so many different ways. Going and taking a walk, noticing nature. What meditation does is connects you to something deeper in yourself, gets you out of the head and the hamster in the wheel. So going for a walk, looking at the clouds, looking at the trees, noticing the swaying of the leaves, look at the grass, noticing your footsteps, maybe just feeling the pavement. You can meditate in the shower and just feel the water flowing over you. You can listen to music and just get still. Journaling is a big one. I really encourage my clients to write. Some people hate writing. I said, well, you don't have to write full sentences. Just write whatever comes to you. Write words, write a haiku, whatever works for you. Get some colored pencils and just scribble then if words aren't coming. Again, the walking, moving your body, going to the gym, even if you're at home just doing jumping jacks or swaying. You want to move your body because so much sits in our bodies and our bodies hold all of this pain. It needs to be released. Taking baths, finding your safe people that you can talk to. I tell people just light a candle. If you have a favorite candle scent, and just light a candle and just stare at the flame, just focusing on the flame and being in that. But also letting yourself just feel all the feelings. Giving yourself permission to cry. And that guttural, that Oprah calls the ugly cry, right? That guttural wailing cry. It's okay to do that. There's nothing wrong with that. Rest. I'm really big on resting. Make sure you're getting rest. Your body is telling you something. I hear people say, I'm so exhausted, I just want to lie down all day. Then lie down. And hydrate. Drink a lot of water.
Okay, the last one for you.
Okay.
Because I think we're at time here.
We are? Oh my goodness. There's so much more to talk about.
I know. We have to have you back. I'm almost certain. But for today, last one. Fill in the blank for me. Being a patient from hell or a caregiver from hell means.
So I think when you first hear that, right, patient from hell, caregiver from hell, you think of it like the bride from hell, right? The mother-in-law from hell. I think the patient from hell, the caregiver from hell is that person pulls themselves up out of that abyss of fear and pain and worry, all of that, the emotions that encompass that, but pull themselves out of that abyss of that hell, because it is a form of hell.
Yeah.
It is a form of hell, and it feels like a nightmare you're living in, but pulling themselves up from that to move forward, to do what needs to be done. And to, like Stephen, just having that attitude of gratitude and finding that hope, even if it's a sliver of hope, and finding that joy and just living, even if it's just in the moment, but living and doing what you need to do.
I am certain a lot of people are gonna really benefit from hearing you speak.
Well, I hope so. Thank you. I love what I do, and I feel very blessed and honored to be invited into people's lives and their hearts.
Thank you.
Thank you.
And I really hope that you continue bearing witness to someone's hardest chapter.
Yeah.
So
thank you.
This podcast, show notes, and newsletter is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or any materials linked from this blog is at the user's own risk. The opinions of the speakers are their own and do not represent the opinions of organizations they're affiliated with, nor do they reflect the opinions of Manta Cares Inc. or Manta Cares' sponsors.